The appointment. The waiting room was quiet except for the soft hum of the air conditioning and the occasional rustle of magazine pages. Emma sat with her hands folded in her lap, her fingers twisting the fabric of her cardigan. She had been coming to this medical center for 3 weeks now, always for consultations, always feeling like she was one step away from making a decision she both wanted and feared. Today was different. Today, she had finally scheduled the surgery. Emma had never been comfortable in her own skin. It wasn't something she talked about, not with her family, not with the few friends she kept at a careful distance. But the discomfort was there, constant and quiet, like a shadow that followed her through every room she entered. The surgery she had chosen was minor in medical terms, but to her it felt monumental. It was a change she had wanted for years, something that would help her feel more like herself. The nurse called her name, and Emma stood, her legs feeling unsteady beneath her. She smoothed down her dress and followed the woman through the sterile hallways, her heart beating faster with each step. When she entered the examination room, she expected the same older physician she had been consulting with. Instead, she found someone entirely different. He was young, perhaps in his early 30s, with dark hair that fell slightly across his forehead and warm brown eyes that looked up from the chart he was reading. He wore a white coat over a crisp blue shirt, and a stethoscope hung around his neck. When he saw her, he smiled, and it was the kind of smile that made the room feel less cold. "Miss Emma Carter?" he asked, standing and extending his hand. Emma nodded, her voice caught somewhere in her throat. She shook his hand, noticing how steady and warm his grip was. "I'm Dr. Arav Mehta," he said. "Dr. Williams had a family emergency, so I'll be taking over your case." "I hope that's all right." "Yes, that's fine," Emma managed to say, though her mind was already spinning. She had prepared herself for this appointment in every way she could think of. She had rehearsed what she would say, how she would explain her reasons, how she would remain calm and composed. But she had not prepared for this. She had not prepared for a doctor who looked at her with such genuine kindness, whose presence seemed to fill the room with a warmth she hadn't expected. Dr. Mehta gestured to the examination table, and Emma sat down, her hands gripping the edge. He pulled up a stool and sat across from her, the chart resting on his knee. "I've reviewed your file," he said gently. "I understand you're here for a cosmetic procedure. Can you tell me in your own words why this is important to you?" Emma felt her cheeks flush. This was the part she had been dreading. Talking about herself, about her insecurities, about the things she wanted to change. But Dr. Mehta's expression was patient, open, without a trace of judgment. She took a breath. "I've never felt comfortable," she began, her voice barely above a whisper. "I know it's not a big surgery, but it matters to me. I want to feel more confident. More like myself." Dr. Mehta nodded slowly. "That's a perfectly valid reason," he said. "But I have to ask, and please know I'm asking this as your doctor, not to discourage you. Have you considered why you feel this way? Sometimes our discomfort with our appearance is connected to other things, experiences, pressures. I want to make sure you're doing this for the right reasons." Emma looked down at her hands. No one had asked her that before. The previous consultations had been clinical, focused on procedures and risks and recovery times. But this felt different. This felt personal. "I've thought about it," she said quietly. "A lot. I know there are the pressures, things people say, things I've heard. But I've wanted this for a long time. It's not about anyone else. It's about me." Dr. Mehta studied her for a moment, and Emma could feel the weight of his gaze, not in an uncomfortable way, but in a way that made her feel seen. "Truly seen, I believe you," he said finally. "And if this is what you want, I'll support you. But I also want you to know that you don't need to change anything to be valuable. You're already enough, just as you are." Emma felt tears prick at the corners of her eyes, and she blinked them back quickly. No one had ever said that to her before, not in a way that felt real. "Thank you," she whispered. Dr. Mehta smiled again, and this time Emma felt something shift inside her. It wasn't the nervous flutter she had felt when she first walked in. It was something deeper, something that made her heart ache in a way that was both painful and sweet. Over the next few weeks, Emma returned to the clinic for pre-surgery appointments. Each time, Dr. Mehta was there, always patient, always kind. He explained every step of the process, answered every question she had, no matter how small or silly she thought it might be. And each time, Emma found herself looking forward to the appointments more than she probably should. She learned things about him in small, quiet moments. That he had studied abroad and returned to practice here because he wanted to help people in his community. That he loved classical music and often played it softly in his office while he worked. That he had a younger sister he was very close to, and that he believed in treating every patient with the same care he would want for his own family. And Emma realized with a mixture of hope and fear that she was falling for him. It was absurd, she told herself. He was her doctor. He was kind to everyone. The way he looked at her, the way he listened, it was just professionalism, nothing more. But her heart didn't seem to care about logic. The day of the surgery arrived. Emma was nervous, more nervous than she had been about anything in her life. Dr. Mehta met her in the pre-op room, dressed in surgical scrubs, his expression calm and reassuring. "You're going to do great," he said, placing a hand on her shoulder. "I'll be with you the whole time." Emma nodded, but before she could stop herself, the words tumbled out. "Can I ask you something?" "Of course. Why did you become a doctor?" Dr. Mehta paused, surprised by the question. Then he smiled, a softer smile than she had seen before. "Because I wanted to help people feel whole," he said. "To give them the chance to become who they're meant to be. Everyone deserves that." Emma felt her chest tighten. "Thank you," she said. "For everything." The surgery went smoothly. When Emma woke up in the recovery room, groggy and disoriented, the first face she saw was Dr. Mehta's. He was sitting beside her bed, checking her vitals, and when he noticed her eyes open, he smiled. "Welcome back," he said softly. Over the following weeks, as Emma healed, she returned for follow-up appointments. The physical changes were subtle but meaningful to her. She felt more comfortable, more confident, just as she had hoped. But what surprised her most was that the biggest change wasn't physical at all. It was the realization that she didn't need to hide anymore. Not from herself, and not from the people who cared about her. On her final appointment, as Dr. Mehta reviewed her healing progress and declared her recovery complete, Emma gathered her courage. "Dr. Mehta," she said, her voice steadier than she expected. "I know this might be inappropriate, but would you like to get coffee sometime? Not as a doctor and patient, just as people." Dr. Mehta looked at her, surprise flickering across his face. Then slowly he smiled. "I'd like that," he said. "Very much." Emma felt warmth spread through her chest, a feeling that had nothing to do with surgery or recovery, and everything to do with the quiet courage it took to ask for what she wanted. As she left the clinic that day, stepping out into the bright afternoon sun, Emma realized something important. She had come here looking to change herself on the outside, but what she found was something far more valuable. She found her voice, her strength, and maybe, just maybe, the beginning of something beautiful.